All right. Thanks for joining us for our program, Dementia, End of Life Decisions. I'm Mary Lynn Maloney with the Orland Park Library. This is the last program in our year-long series on dementia awareness in support of the dementia-friendly Orland Park initiative. Once again, our speaker is Aishling Dalton Kelly, CEO of Aishling Companion Home Care. Aishling is a certified dementia practitioner, and her agency offers a variety of dementia education classes. We'll have time at the end of the presentation for Aishling to answer questions from the audience here. And for those of you on Zoom, if you have questions as we go along, feel free to type them into the Q&A or the chat section, and we'll ask Aishling to address them at the end of the presentation. And now I'll turn the program over to you, Aishling.
Thanks, Mary Lynn. Well, good evening to those that are here in front of me here, and I'm not sure if we have anybody on Zoom or not, but as Mary Lynn said, this is the final presentation in a series of 6, as she had just said, in an endeavor that we're doing called Dementia Friendly Orland Park. And this is part of Dementia Friendly America, which is putting on all of these programs and encompassing villages and asking villages and communities to come together and be part of dementia friendly, because clearly there's a big issue with dementia and it's very much on the rise. And just to give you a little statistic, globally every 3 seconds a person is diagnosed with dementia. Here in the US, it's every 15 seconds. So with our baby boomer generation exploding between now and the year 2050, we have to learn better ways to help families that have a form of dementia, in addition to providing resources to you, the caregivers. And when I say caregivers tonight in our presentation, I'm going to be talking about not necessarily paid caregivers. I'm talking about spouses, or sons, or daughters, nephews, or nieces. So this is all about end of life decisions, and it's a horrible subject to have to talk about when we're all living and we're alive and we're kicking, but sadly it is part of the circle of life. And we're going to focus tonight really on the dementia piece, but the reality is for those of us that are here and listening online that don't have dementia, it's still a good topic to talk about because we all should be involved in our end of life decisions. Tonight, we're going to focus on 2 very specific decisions in regards to palliative and/or hospice, but there's a lot that comes before that as well, in regards to if you have, let's say, a lot of money or you have a lot of property, you would potentially be putting all of that in trust. You possibly would have a will. There's a lot of people die and have none of those things in place. And I'll share a brief story with you before I even start the presentation tonight of a woman who about 3 months ago was coming under my care, but I never got her because she was still in the hospital, and she was 97 and she was cognitively 100%. And she only had one other sister who had died 3 years previous with no will, nothing put in place. She too was cognitive. Both happened to have medical issues, of course. And the neighbor in the condo building where both sisters lived just knew both of these ladies. And when the first sister died, he was the neighbor of the second sister, who was 97 years of age. And he said to her, maybe you should start putting your arrangements together for end of life. I mean, my goodness, she was 97, right? But she didn't do it. And sadly, she never came out of hospital, and a total and utter stranger had nothing but issues in trying to find her paperwork. We found out she didn't have any, so that was easy. But it became a huge challenge for him to get her body released. He wasn't her next of kin. There was no next of kin assigned. And then there was all sorts of issues that he encountered as a friend that happened to be in the building that just happened to have a good relationship with this lady. The reality is this lady was very, very well off, and all of her money went to this lady. Now that's fine, that's okay too, but point in case is the reason we have these ugly conversations about end of life is because some people love animals, some people love children, some people like to support the children in Africa. So The truth is that if you plan ahead, regardless of a dementia diagnosis or not, your wishes are honored and your money in your estate goes to where you want it to. So for anybody who's listening tonight, we're going to be talking about the very final decisions that we're making. But the truth is there's lots of decisions that should be made up to this point. So if you want a will, you need to go and get it. If you want to put stuff in trust, you have to engage an attorney to put all of those things in place. In addition to healthcare power of attorney, if you have a loved one who has a form of dementia and you are their spouse or their child, you will have to put those papers in place and get it all done legally before your person is deemed with not being competent, because then you now have another battle on your hand. And we all know with paperwork, it just becomes a paper trail and it's really hard. So the purpose of what we're talking about tonight is to be transparent about the decisions that we can or don't want to make, but at least you're educated enough to know that you do have choices. Okay. So the first topic that we're going to talk about tonight is called palliative care. Now, palliative care it's been around for a long, long time. However, in the last 5 years, it has become very popular. And I'm going to share with you a little bit further on why it has become popular. A lot of people don't want to die. They just don't want to give up, but they may be very, very sick. And if that is the case, palliative care is the superstar in this particular case if you don't want to resign yourself and you want to keep fighting, but you're going to need extra help, then palliative care is the care that you would be looking for. It is specialized care for living people with a series of illnesses. The type of care is focused on providing relief from the symptoms and the stress of their illness, but the goal is to improve the quality of life that is left for the person that is sick with all of these illnesses. Palliative care, and I don't want to get into the weeds too much on it, but palliative care covers a lot of the stuff because of insurance, but it doesn't cover a lot of other stuff. That is something that you would have to talk to your insurance people about or check on the back of your medical card. Palliative Cares works with your doctors or your loved one's doctor, and they all focus on the quality of the patient that they're all taking care of. In other words, your loved one can still attend his or her own doctor, but you're bringing in an additional team to manage everything. And the palliative care treat people suffering from symptoms and stress of very serious illnesses and possibly multiple illnesses, such as maybe cancer and or congestive heart failure. They may have COPD, could be chronic diabetes, there could be kidney disease. So lots of different diseases that they call comorbidities, commingling all at the same time. So why would you consider palliative care? Well, say if you had a loved one who had a form of dementia. So the whole entire goal, like I had said about the palliative care, is to give quality of life that's remaining to the person who is sick. Symptoms for the person who is sick could be a lot of pain, but that can be managed. They may be depressed, that also can be managed. They may have shortness of breath or fatigue, most especially if they had COPD. And typically, when a person is very, very sick and there is a lot of medications involved, you do have the constipation, you have that nausea, you have that loss of appetite. They're all almost guarantees when a person is extremely sick and they're in palliative care. On top of that, you may have a loved one who can't sleep and then they're starting to get anxious. So this is where the palliative team manages all these different symptoms to help the person who's really sick have a quality day every day for as long as they have left. The team you get will carry the strength and give you the strength as the caregiver, basically to manage your loved one and give you some sort of hope and support as you're working your way through the disease with your loved one. So what does a palliative care team? Well, palliative care teams are specialists who work, like I had said, with you, being the caregiver, your family, and your other doctors, like your family doctor. They provide that extra layer of support when you need it most, in addition to treating the symptoms and stress, supporting both you and your loved one. The palliative care will communicate directly with your doctor and with you so that everybody is on the same page. And they are there to support you every single step of the way. Now, the next piece we're going to talk about is hospice. And as I had said to you before, a lot of people do not like the word hospice. They shy away from it, and because they don't want to talk about death. And when they hear the word hospice, they just automatically assume that the person is going to die straight away. That is not the case. And it's something that I'm passionate about educating about, because hospice is a beautiful thing if that's what you want to do, but it's not a beautiful thing when you leave it till the last minute, which is why we're having these conversations tonight to talk about how do you want to proceed. So the palliative piece can come way before hospice. And if the person is doing pretty good on palliative care, they will keep coasting on palliative care. But when hospice is needed, the palliative care, it just transitions right into hospice. So there's no break in coverage. And that's a really nice thing for you as the caregiver if you're really afraid of this timeline with the hospice piece. So hospice, what exactly is hospice? So again, I'm going to be giving you a very general time frame. Most people are put in hospice when the expectation that they're going to pass is going to be, in the doctor's opinion or the team's opinion, probably somewhere between 0 to 6 months. Now, it's not as clear, definitive as that, because I have had people in hospice for 3 years and they just keep qualifying, but they're still really sick people. So this is where the misconception needs to be cleared for families so that they understand. And make no mistake about it, there are people who go into hospice and they do die up to 6 months. It just depends where they're at in their journey. And this is why it's nice to consider the palliative piece before hospice. So one just transitions into the other. So a hospice, obviously a team is brought on when a person is extremely sick. And basically when hospice comes in, usually the family and or the person who's very sick has decided that they just don't want to fight the disease anymore. And that's why they would enter into the hospice program. People may choose to enroll in hospice care if the treatment is unlikely to be effective, or if continuing it has become too burdensome. Hospice aims to provide comfort and peace to help improve quality of life for the person nearing death. Now, before we explain a little bit deeper about what hospice is, I want you to understand that every family can pick their own hospice company, okay? And hospice companies are like a lot of other companies. Some do a really good job and some do an okay job. If you pick hospice because a family friend has used them or you've heard that this company is really good, that's great. But during your journey, if you're not happy, just know that you can take on another hospice company, but you would never take on another one until you make sure that the transition is going to be clear from one hospice company to the other so that there's no break in service. Okay, so you do as a consumer have that choice, and you should always do your due diligence also about your hospice companies and asking them if they have references and could you speak to families who have used them, because it's your loved one that you're putting into hospice and you want to make sure that you're able to work with the teams and that they're working for you. So what can you expect from your hospice team? I personally think that hospice people are all angels. They are certainly not people who are in the job for money. They most definitely are dedicated because they're around death and dying people all the time. They're usually very, very positive people. They're very compassionate people, and they're doing what they're doing because they love to actually help families. And that's what's important, because at this stage, for what you're all going through, you need the support every bit as much as your loved one that's in hospice. So your hospice team can provide a whole range of services depending on the symptoms at the end of life and the care wishes of both you, the family member, and your loved one. The services provided are not limited to just emotional and spiritual support for the person and their family, but they also will give you relief of symptoms and pain for the patient and will help with advanced care and planning. There's therapy services that they will give you, like physical or occupational therapy. And in addition to that, they have, not all hospice companies, but some have like music therapy, they have social workers, they have volunteers. So again, doing your due diligence in finding the right hospice company for you is very important. Now, I suggest that if you're going down this road, same for a palliative, if you're hiring somebody, that you put together like a little checklist, right? So that you know the hospice companies that you're considering. You want to make sure that their locality is close to you as well. That's very important. And you want to make sure that you have all of their numbers and who your team leader is, that you would have all of those at your fingertips in your house. So where is hospice care delivered? Well, hospice is delivered in the home. So where you're living today, if you have a loved one who wants to pass at home, the hospice can come to your home. We have a lot of elderly today that are in communities and facilities that they consider their home. So in essence, the hospice team can go there. There is hospitals that have wards or hospice units that people can sometimes, when they're in the hospital, they are transitioned to the ward because they're too sick to move or they don't want to be at home to pass, so they will go into those units. And then there is such a thing as a hospice house, and Joliet has one. There is another one coming soon here in Orland Park. There are special houses that just take care of people that are transitioning in hospice care. And that's a really nice choice as well. So what happens when you do bring, we'll say, a hospice company on for your loved one? What sort of things are going to start happening? So of course you'll have, like I had said, a whole team. You'll have a pastor, or you will have a deacon or a chaplain, they sometimes call them, dependent upon what your religious beliefs are or what's important to you. They will come to visit you wherever your loved one is. You'll have, again, social workers. You'll have a nurse that will be visiting to come in and manage the pain. Usually the nurses come in twice, maybe 3 times a week. Again, it depends on the care plan that is written for your loved one. You'll have a CNA, which is a certified nursing assistant, and he or she will come in and they will help with I say the heavy lifting, but they're not lifting your loved one, but with the bed bathing or the transferring into a shower or from bed to the chair, dependent upon what your loved one is able to do. They will come in and take care of all the personal hygiene needs. They'll help with laundry, changing the bed, possibly doing errands. So they're part of this big team that we talked about, and they're there to help you. The CNA, I think, comes out maybe once a week, maybe twice a week. Again, all comes back to what your insurance covers and which hospice company you decide upon bringing in. And this is where the big education for people who are listening tonight, you have to ask those very difficult questions, because of course people will do the minimum, but there's other companies who do way more than the minimum, not because they're being paid to do it. it's because they're really faith-bound hospice companies, or they're small or private, or it's just their company mission. I think one of the biggest misconceptions for families who go down this hospice journey, they actually think that hospice is 24/7, 7 days a week, and it's not. Now, there are hospice companies dependent upon when they take your loved one in, and I have seen this happen, where they have never left the bedside for 2 or 3 or 4 days because they got the person too late and they're extremely sick, and they were trying to manage all of the symptoms and the pain. So they were at the bedside. That's another question that I would absolutely ask, especially if you're a spouse and you don't have any children or any neighbors or any friends to help you. You can't do everything yourself. So check out if they actually do have 24-hour care hospice, and when might they bring that on board for you if you were in that situation, because not every company that does hospice care offers that. So it's a great question to ask. And then you have, like I said, volunteers that will come in really just to maybe make you a cup of tea or make you a cup of coffee, or just to sit and hold your hand. Sometimes there isn't any conversation, but you have those volunteers as well that are community members, and all hospice companies have those folks, and they kind of want to give back. They're usually older people who just love what they do. They love life and they love helping, and they will volunteer. And they're trained, of course, with the hospice company. They're fingerprinted, they're safe to be in your house, but you have those people who come on board as well. So there'll always be a care plan, and a care plan is similar, we'll say, to what I was saying to you about your little checklist of all the details that you need to know. But all hospice companies would put a care plan in place, and that care plan would consist of all of the details, all the insurance details, all the medications that your loved one is taking. And then they would look at the whole entire picture and then add in different medications, and they would be checking back with their care plan every single time that they're in the house. And then they have a medical director that the nurses would be talking to back in their own office about maybe additional needs or things that need to be tweaked or changed or increased or decreased. This would all be written on the care plan when they meet with you. Now, hospice, for I think an average company to bring a patient on board, I think you're talking about 6 hours of paperwork, where they would be sitting either in your home or in the hospital in a meeting room with you or wherever. It's not something that's fast because there's a lot of paperwork. So you want to keep that in mind as well. And again, like I had said, if you weren't happy with one hospice company and you wanted to change, they don't share paperwork to where it just goes from the company you're firing to the company you're hiring. You have to start all over again. So keep that in mind too. So the family members, if there are around, would be involved in these decisions. They would sit with the nurse and they would go over all of this paperwork. Obviously, you would have other hospice members too, and of course your doctor. Keep in mind as well that all hospice companies have their own medical director too, but you most certainly can consult with your own doctor as to if you think it's time to maybe have this discussion. I will also share with you that if you look at the way life is and you've had a family doctor for 20, 30 years, it's rare that doctors will say to you, I think it's time for hospice. I don't know why that is, but it just doesn't happen like that. It's usually a bystander or a nurse or somebody who is seeing these constant struggles or constant readmittance back into the hospital that may be the one that will suggest that to you. And that's why I'm saying to you today to always keep in your mind, should you be instigating that conversation, because it's an ugly conversation and nobody wants to have it. So keep in mind that it is something that you possibly should bring up. And again, I don't mean a month or 2 months before. When you see a significant change of condition, most especially because we're focused here tonight on dementia, you'll know when you see things transitioning, and that's the time to get hospice, not 4, 5, or 6 months after you've noticed significant changes. And we can talk a little bit about those at the end of the presentation if you're not sure, because it's very hard. Again, if you're non-medical and you're with your loved one every day, it's hard for you to say goodbye as well, but none of us want to see our loved ones suffer. And when they're literally not able to do anything anymore for themselves, it is a question that you need to start thinking in your own head. Should I have those conversations with a hospice team? So all hospice companies, so you know, they have to be licensed, they have to be certified. Your hospice benefit is 100% covered by Medicare Part A. Okay, so palliative care isn't. And again, I'm not an insurance person, so I can't really speak to what's covered and what isn't. But I know in the palliative care option, there are certain things that are not covered. However, in hospice, you are 100% covered under your Medicare Part A benefit. So you'd always ask, of course, which they would give you, the licensing and the certification, so you have it. When you're having this initial sit down, we'll say exploratory discussion with the hospice, you kind of have to have all of your questions ready so that you can ask all these questions up front. And ask them what sort of services they do provide to you. So for example, I had said to you that a CNA comes out and will do the bed bath and or the shower. Well, if you think about us, most people probably shower every day. When you're really, really sick, you're probably having a bed bath maybe twice a week, maybe 3 times a week. It depends on the condition of your body, depends how often this person is soiling themselves. It depends on how much they're drinking. There could be, you know, skin breakdown. So a bath actually becomes a really important part of that person's care. You want to make sure when you're meeting with the hospice company that you're asking them, how many days are you sending a CNA? Because sometimes it's only once a week. So therefore, the question is, who's doing the bathing on the other 6 days if needed? So again, a really tough question to ask, but you want to be at minimum hiring a company that's going to be coming out twice a week. Otherwise, it's going to be you. And that's really hard to do when you're trying to turn a person in the bed with no experience. It's a dead weight and they can't communicate with you or assist you in any way. So let's talk about some important facts about hospice. Hospice, as I had said to you earlier, is for people with advanced illnesses. Hospice provided symptoms and pain management for patients with serious illnesses, no matter their age, culture, beliefs, or cause of illness. Now, I want you to take note here with the culture piece. Some people, and again, it comes back to my little story that I shared with you earlier, you kind of have to ask them when they're well, if it is something that they would even want, because there are some cultures who forbid hospice. So if you were a non-family member and you know that they don't want hospice, then that might not be an option for you. So you need to be making sure that if they're not a family member, that you're respecting their wishes based upon their culture and their ethnicity and their beliefs. Like I had said, you can have the hospice care anywhere you like. For the most part, people want to stay in their own homes because their homes are familiar, they're comfortable, there's that extra sense of security. I've seen a lot of people plan to die at home and got so sick at the end that they had to be transported to a hospital. And sometimes, sadly, that happens as well. And then they ended up dying in the hospital. So there's that piece too. And that's another great question that you could ask your hospice company when you're talking to them. What would be the conditions that this would happen so that you are prepared? Hospice, as we had said, is most definitely a choice. It's not for everybody. And I can also share with you that when a person is in hospice, you're never supposed to call 911, because when you put somebody in hospice, you have signed paperwork to say that we're going to walk this walk together, we're going to go this journey together until your loved one passes. However, I call this Murphy's Law because I'm Irish. There are people who have called and do call 911 in hospice, and then the hospice is revoked. In other words, everything stops and then you have to start all over again, assuming that your loved one would qualify. Now, you might say, well, why would somebody do that? Well, I'll tell you another little story of a lady of the man that I shared with you that I had for 3 years that was in hospice. He started coughing one night out of the blue and his wife panicked. She was an 87-year-old woman by herself. She couldn't reach her kids. So she called 911 because she wasn't ready to let him go. Even though she had signed him into hospice, she wasn't ready. She wasn't ready emotionally. She wasn't ready, period. So she called 911. So her kids were furious with her because he went to the hospital. Of course, he came back home and they had to start the journey all over again. But you also have to understand that she was very elderly and she was scared. She was scared and there wasn't anybody around to help her. In other words, there wasn't a hospice team there at the time that this happened. So she did what a normal person would do, and she called 911. But regardless of that, if you are going down the hospice journey and you decide 3 months in, oh no, I don't want to do this, you can absolutely revoke the paperwork and you can stop. You absolutely have the right to do that. So just know that you can and never make a decision unless you're comfortable with the decision 100%. So there are some patients that will keep taking some medications while in hospice. Hospice patients are prescribed medicines that manage their symptoms of their advanced illness and improve quality of life. Hospice can give medicines as needed to help with the symptoms. Hospice doctors, of course, do try to give just enough medicine to manage the symptoms and ease the pain. Family or friends, like we had said, provide care with support in addition to the hospice team. Usually, family and friends are the main caregivers in addition to the hospice people coming in, because family and friends are usually there all the days that hospice is not. So here we have a slide that says there's no limit to the time, like I said, a patient can be on hospice. And again, this is the big elephant in the room that nobody wants to talk about. Most people they're just not educated on this topic or about hospice, and they just assume that when they hear the word hospice that the person's going to die straight away. Like I said, the expectation, if you like, is that the person may live anywhere from 0 to 6 months. Now, when a hospice company comes into your home, there's a lot of movement. In addition to all the paperwork that you have to sign, if you're keeping your loved one at home, you're really now making your home almost like a hospital in the sense that there's a lot of equipment. It's called DME, durable medical equipment. So there has to be a hospital bed for everybody that's taking care of your loved one. Everybody has different heights. Not everybody is tall, not everybody's short. So they all have to be able to move a bed that can move up and or down easily. And there may be oxygen concentrators and tanks. That's another piece of equipment that will be coming into your home. So in essence, be aware that there's a lot of changes while everything is coming in the home and you're signing all that paperwork. And it is going to look a little bit like a hospital when you start out first. After the patient is taken care of with all of their needs on the hospice journey, when your loved one does actually pass, the hospice team, of course, remove all of their equipment and extra medications out of the house, but they're very much there for the family for a whole year for emotional support for you. And the chaplain is available to you. There are support groups that are available to you and counselors as well. So here's some traits of a hospice team, just like I had said earlier, that they really are like angels. They're obviously very, very compassionate people because they love what they do. They are extremely professional and should be professional. And I'm not suggesting that any hospice company would not be professional. But again, if you have a team in a company that you don't feel are warm and fuzzy or are quite short and maybe bad-tempered, then possibly they're not the company for you. And you do, like I said, have that choice to change. But for the most part, they are extremely professional individuals who totally understand your journey. They have a lot of experience and they're very well up to date on what they can do for you and how they can help you. So just know that you really are part of a really good team. They are very respectful, of course, of your space, and they're going to treat both you and whoever else is in your home, in addition to your loved one, with dignity. And they do care, of course. They're extremely, extremely caring people. And they care much more about the person than they really do about the disease and about the people that are in the house, like if it's you, that's the son or the daughter or the wife. They do care about you. They care about your history. They care about your future, even when your loved one is gone. So we talked a little bit about this already, that hospice is paid for at 100%. And again, the reason I share that with you is because if you don't understand what hospice covers, we'll say, and you don't have hospice, hourly care from a home care company is anywhere in the range from $26 to $32 an hour, right? So you could be spending an awful lot of money when the situation is going to be the same situation if a person was in hospice. So why not consider the hospice piece and then add in what you need as needed, as opposed to having all of this care that you're paying for out of your own pocket. So again, something you need to think about on this side of it before you need it. So the Medicare hospice benefit covers everything for the end of life service related to the patient's terminal diagnosis in whatever setting your loved one calls home. If it's a traditional residence, it's covered. If they're in an assisted living facility, it's also covered. Or they could be in a nursing home, it's 100% covered by Medicare Part A. So now we're going to talk a little bit about what's called Vscd, which is voluntary stopping eating and drinking. And this is accompanied with pain and symptom management, of course, to minimize discomfort. Some people feel hunger and thirst during the first few days if they choose this option, but everybody has the right to refuse food and fluid. Working here is very important that you're working with a hospice or a medical team. Families of those in care facilities may need to work closely with the staff to ensure that the staff that are there when you're not there are also honoring your loved one's choice to not eat and or drink. When this Vscd is sought at home, it should be medically managed, of course, to manage and minimize any of the discomfort that your loved one would feel. So declining or stopping life-sustaining treatment. Treatments for health conditions or to prolong life, such as use of a ventilator, a feeding tube, an IV hydration, antibiotics, or cardiopulmonary resuscitation, can be refused or stopped at any time. Things to consider about this option. The pain and the symptom management are used to ease any discomfort. Anybody can refuse any medical treatment as well, and those in a care facility may need to work closely with the staff to ensure, again, that the staff will honor that you have decided to take out the IV lines and you have decided to take away the oxygen concentrator. You want to make sure that, again, if they're not under your watchful eye at home, that they're in a facility, that everybody is following your wishes while you're not there. So there is such a thing as well called palliative sedation, and sometimes it's called terminal sedation. And the reason it's called that is because their patient is being sedated and that sedation is going to carry them to the end. Now, you can't just say, I don't want to live anymore and I want palliative sedation. It doesn't work like that, right? Palliative sedation would really only happen if, we'll say hypothetically, that you had somebody in the very final stages of dementia that still had all of these other very painful conditions going on. And the patient could be extremely anxious. They could be moaning and groaning in a lot of pain. Obviously, they're under hospice care, and it's quite disturbing for a family to watch their loved one transition like that. This is where it may be suggested by the family or by, we'll say, your team, that this palliative sedation could be an option for your loved one. But typically the person remains unconscious until death. In other words, they're not going to be communicating with you back and forth anymore. And usually in end stage dementia, I've never seen anybody in end stage dementia communicating to tell you what they want to do anyway. But if there's pain and they're communicating that through their movements and maybe flailing around the bed and things of that nature, this is potentially an option as well to kind of put them at ease and have no pain until they transition. Obviously, this has to be medically managed by a healthcare provider and overseen completely by the doctors. Those seeking this option must ensure that their healthcare provider will honor it as well. So there is also such a thing as medical aid in dying, and medical aid in dying is a safe and trusted medical practice in which a terminally ill, mentally capable adult with a prognosis of 6 months or less to live may request from his or her doctor a prescription for medication which they can choose to self-ingest to bring about a peaceful death. Now, this is not legal here in Illinois, but there are 9 states in the United States that a cognitively fine, very sick person can do this. Illinois, like I said, is not one of these states. Things to consider about this option. For some people, simply having the prescription brings comfort, whether they use it or not. And sometimes they obtain the prescription, but they don't use it. There are 9 states here authorized to do medical aid in dying. They are Oregon, Washington, California, Montana, Vermont, Colorado, Hawaii, New Jersey, Maine, and the District of Columbia. This option, of course, can be used at home or in a skilled nursing facility, or again, wherever the patient calls home. So we had talked a little bit about dementia, and this slide is just a recap from when we kind of started out almost a year ago, I think now, Mary Lynn, on our very first presentation about dementia. There are 3 stages, typically the beginning, the middle, and the end, the mild, the moderate, and the severe. If you're considering hospice, you really shouldn't be waiting until that final stage, that end stage. You should be really thinking about hospice towards the end of the second phase of dementia. And again, there's no definitive line or light switch that goes off. This is okay, we're here now. But if you're watching the signs and you're looking at everything that's going on and the inability to do almost everything for themselves, if it's something that you're thinking about doing, then do your research, interview those companies in advance so that you have a plan in place. And I've said this, I think, at every single presentation. If you fail to plan, you can plan on failing. And let me tell you, I could write a book with the amount of families who took hospice literally within 24 hours of the person dying. And it was an extremely, extremely stressful situation for everybody involved. And it's a stressful situation to begin with, to even resign yourself to the fact that your husband or your wife or your mom or your dad, that now you're going to have to say goodbye. That's really hard to begin with. So you need all the help that you can get. So again, having the little bit of education and asking all of these questions and just doing a little bit of research is highly suggested. I'll also share with you that my mother had dementia for 7 years, and my mom actually and my father both died in hospice. And although I didn't enjoy either of their funerals, of course I didn't, it was final, but I can tell you that the lead up to the time when they passed, I wouldn't regret one single day or do it any differently if I was allowed to do it all over again, because we had time as a family to have those conversations, to sit by the bedside, to not even say anything, just to be. And that's extremely important, most especially for caregivers, because you carry the guilt of all of the things that you possibly should have or could have done. When you have hospice in place, you have time to say goodbye. And it's a journey, but it's a beautiful journey, as opposed to bringing it on too late and then it's a state of activity when the situation is going to be the same anyway. So keep that in mind. I put this picture up here for you because the traveler has reached the end of their journey. It is indeed the circle of life. It all comes full circle for most of us as we near the last stages of our lives. Faced with the realization of our own mortality, we suddenly recover our sense of wonder for the world, how beautiful it all is, and how blessed we feel to still be alive each day. Our sense of wonder is renewed due to our discovery of an old outlook. So again, there it is. It's on the slide. Fail to plan, plan to fail. Eventually, caregiving for someone with dementia won't be appropriate anymore. The needs of a person with progressive dementia becomes so overwhelming for you as the caregiver. Sometimes moving them into a full-fledged facility might be your only choice because you as the caregiver are just exhausted. So again, think about those things in advance, because you may need to actually do that dependent on the situation, the help or lack thereof of people to help you or family members. And again, plan on this way before you need it. I forgot to mention that part of the hospice plan, of course, as well, would be that, you know, you would have all these bereavement services available to you afterwards. They get you through the first of every occasion, the first birthday, the anniversary, the Christmas, the Hanukkah, whatever the person lifestyle had them celebrate. So that's a nice thing, because it is very hard for the caregiver, being you, the spouse, or the son or the daughter. It's very hard and it's very lonely. Bereavement care, of course, is an essential component of hospice care that includes anticipating grief reactions and providing ongoing support for the bereavement period over a 13-month period after your loved one dies. I have seen some hospice companies even stretch it to 2 years. I have a friend who owns a hospice company in San Diego, and he follows the family for 2 years afterwards. And it's a really nice thing. And they actually, a lot of them become friends. And he introduces them to other families along the journey in their support group. So it's almost like there's life after death for some of these family members that are alone. And bereavement, which I'm sure everybody understands, refers to the state of loss, grief, and the reaction to loss. And I can also share with you, because I've lost both of my parents, it doesn't matter if you know they're dying. It doesn't matter if you're there every second of every day. It's still a shock when they die, because life doesn't teach you to deal with those emotions. And those emotions only come after the heart stops beating, even though you're prepared. So it's tough. So time heals everything. Like I said, fail to plan, plan to fail, ask all of your questions. There's some pictures up there of my mom and my dad's life, which came full circle for them. And again, just to share with you, we did have hospice, and I'm so glad that we did. So take in everything that I've said tonight, and if I can help you in any way, shape, or form with any additional questions, I'm happy to take them now. I don't know, Marilyn, if you have anybody online that has any questions, but for any of you that are sitting here, if you have any questions, I'm happy to answer them for you.
Anybody have any questions?
Excuse me, Aishling, I don't have any questions online in
Okay.
the chat yet. But if anyone has questions here in the room, please feel free. And if you do, Aishling, could you recap their question just so that
Of course.
it's captured
of
on the
course.
recording? Thank
I
you.
don't think, do you have any questions for me? Right. Okay. Okay. That's what I was going to say, because if he doesn't, the question was, we have an audience member whose husband doesn't qualify just yet for hospice. So what I would say to you is if he's really sick and you took that step to investigate that, then he doesn't qualify for hospice, you very well may qualify for palliative care, and that'll be a great help again to you. And again, it's the preliminary from the change from the palliative into hospice. Just so you're aware, does both. A lot of hospices just do hospice. This palliative transitioning into hospice is very much a new thing in the last 2 years. I never heard, and I'm in healthcare 10 years. I only just heard of palliative places and hospice places. Now it appears that all of the places that I knew were hospice places are now palliative care, because they too are encountering the challenge of getting families so late. And we're trying to all educate together to show you that you do have options. So I'm sure that your husband will qualify for palliative, and I certainly hope he does.
You mentioned that it's not covered by Medicare.
I don't know the specifics of the insurance. It's not 100% covered. Hospice is, but again, they will tell you, whichever companies you interview, make sure if you're getting palliative that you're hiring a company that transitions from palliative into hospice. Don't just hire a palliative company, because then you have to do all this paperwork again with another company. So try and find one that does both. Good, good. And I would ask them, it's something to do with some sort of the medicines. And again, I wish I could give you a more definite answer, because I hate vague answers, but I'm not a specialist in the insurance piece, but I just know that some of the medications are not covered. So ask those questions, take out your husband's list of medications that you know he has to have or whatever, and have those discussions with them, and they'll tell you. Any other questions?
Do you have any advice on, I have both of my siblings, I think will probably not necessarily be ready kind of for this discussion. But my dad is pretty much in the end, second, kind of the end of the second stage.
Sure.
He's still active and all that. He'd probably be fine for a while, but I see the need. Do you have any advice on kind of how to bring up the subject, or how to kind of give some, I don't know, selling points?
Sure. So the question is, for those listening online, the question is that what happens when you have a family member who's really sick, and you have, well, say one sibling that's thinking of having these conversations or bringing these conversations up, but they know that their other siblings aren't going to be on board. So to answer your question in the best way that I can, it's like planting a seed, and you just keep watering it. Nobody wants to have the discussion about what's going to happen, Dad, when he dies, or let's talk about hospice, or let's talk about that. But it is the mature thing to do. They probably won't be happy. I certainly wouldn't suggest you bring it up at the Thanksgiving dinner table for sure. But what I would do would maybe call your siblings and say, hey, could we have a family meeting, maybe meet for a beer somewhere quiet, go out for lunch or something, and just be totally transparent and say, I know none of us want to think about this day, but we all know it's coming. And I really want for Dad to be ahead of it. I don't know if your mom is still living or not, but you're coming at it from a very compassionate point of view, to where you don't want your dad to be in any pain, and that you want to talk to your brothers and sisters and say, I really want to hear your feedback. What are you all thinking? Or have you not thought about it? Because now when you plant that seed, they're going to start thinking about it. And whether you have a good relationship with your siblings or not, there's so many family dynamics that are involved. I know when my mom was dying, one of my sisters said, no, let's stop. But my mom was within 24 hours of dying, and we're like, no, it's too far now. There's no going back. We had this discussion, but it is hard to sit by the bedside and to watch. So again, plant that seed with your family, and I don't know if you're the eldest or where you lie insofar as the youngest or the middle or the only son or whatever. The conversation has to be started sometime. So I would say it's not probably going to be a pleasant one, whether you start it now or 6 months from now, but I would definitely just have that conversation and see where it goes. And you might be pleasantly surprised, because most families don't want to see any of their parents suffer, and they're willing to have the conversation, and it may be a very emotional conversation, and that's okay too. So I would start there and see where it goes.
Use this as a
Absolutely.
springboard.
Absolutely. And I think too, I think telling them that you've attended a presentation shows them, that you've taken that extra step because of the love that you have and respect for your dad. I don't think anybody would look at that in a bad light. Again, a lot of the reasons people leave it too late is because they're afraid, and they don't want to have those conversations, or for all intents and purposes, they actually don't know anything about hospice. And like I said, hospice is a beautiful thing if you know everything that it entails, but some of the reactions from your siblings might be absolutely not, because they don't know what I just shared with you here tonight. They don't know all the things that it involves. And I do believe, and I'm not 100% sure, because both my parents died in Ireland. I would imagine that if you're thinking about having that conversation with your family, that I am sure that a hospice company probably provides where they have conversations with families. If you're concerned, I would imagine that would be part of what they offer. Certainly something I would ask, but I would handle your family first by yourself. And I would do it sooner rather than later. And then another couple of weeks, couple of months, bring it up again and see out of your group of family members who's continued that conversation with you. And then get everybody on the same page. Like I said, hopefully all of them will be on the same page, because they all want to do the right thing by their parents. Does that help? Okay, good. That's it.
That's it. Nothing from our online attendees. So
Okay.
thank you very much, Aishling. As always, appreciate the information.
No problem. If anybody has any questions that you think of afterwards, I'll leave my card here for you. You're more than welcome to call me, and Mary Lynn can always get a hold of me if anything comes up in the future.
Yes, anyone can feel free to send me an email at it's outreach@orlandparklibrary.org.
So outreach@orlandparklibrary.org. Okay.
Right.
Happy Friday and stay safe, everybody.
Good night,
Thank you so
everyone.
much.
I figured out your doctor, why doctor, tell anyone to go to hospice.
Well,
Not to make light of it.
yeah,